Just give me one. So again, I'm Kathleen O'Toole Smith, and I'm going to tell you a little bit about the background of the BOLD grant. The BOLD grant was released by the Centers of Disease Control and Prevention, or the CDC, and it offers a public health approach to addressing Alzheimer's disease and related dementia. BOLD, or BOLD, stands for Building Our Largest Dementia Infrastructure for Alzheimer's Disease. It's a 3-year grant from 2020 to 2023, and in Wisconsin, it includes 13 projects. The funding for the grant is approximately $300,000 a year for each year of the grant. Kristen Felton, who's presenting with me today, is the author.
Good, how are you?
Is the author and the principal investigator of the grant, and I am the BOLD grant manager. So what is the public health approach to this grant? Although we cannot prevent the diseases and the conditions that cause dementia, there are known risk factors that can be reduced throughout the progression of the disease that can make a difference to the quality of life for people living with dementia and their family caregivers. This is really the crux about what we're going to be talking with you about today, and Kristen is going to go into a lot more depth on this in just a bit. So to describe the approach of the BOLD grant, there are really 3 levels. Primary prevention is promoting messages around brain health to reduce the risk of dementia. Secondary prevention is promoting early detection and diagnosis of dementia. And tertiary prevention is managing the comorbidities and reducing preventable hospitalizations. The CDC also recognizes the vital role of family caregivers in this matrix and has included activities to support caregivers in this grant. So what do we hope to accomplish? Well, we look to increase the reach of existing statewide public health structure and our programs. We are providing education and messaging around dementia, brain health, and caregiver support. And we're promoting the disease prevention, early detection, and diagnosis of dementia. I think also central to this project is addressing health equity. The projects and the strategies of the BOLD grant will specifically address disparities and health outcomes for people who are African American, Native American, and Latino. People with disabilities, including individuals who have vision or hearing loss, of physical disability, or those living in rural and underserved areas will also receive targeted messages to increase accessibility of information. I know that this is important to many of you because this is our state. We are both rural and urban, and I know that you're talking to a diverse group of people in your talks. So a little bit about our partners. One of our central partners obviously is you at WIHA, but we'd also like to shout out to the Alzheimer's Association, the UW Center for Interprofessional Practice and Education, the Wisconsin Alzheimer's Institute, the Department of Public Instruction, and the Wisconsin Primary Healthcare Association. We also are blessed with statewide partners. We really do in Wisconsin have very rich networks of people reaching out to people who have dementia and their families, and we're really blessed in the state to be very advanced. So as I go on, I'm going to tell you about a couple of projects that we're working on, just to kind of give you a flavor of what BOLD is looking to accomplish. And then Kristen is really going to delve into the details. So the first group that I'd like to talk to you about is the UW Center for Interprofessional Practice and Education. This group is a group that has created a network of short courses. So they provide short courses for students on topics that will help them succeed in their future professions. As part of the BOLD grant, the CIPE will create a short course on the topic of understanding the special needs of family caregivers, of people living with dementia, and using that knowledge to help those young students in their professional careers in the future. The goal of this short course is for students to learn about the challenges and the joys of being a caregiver for people with dementia. And they will learn about the special circumstances that caregivers face and how the stress of caregiving can actually impact that caregiver's own health. So the students come from a variety of backgrounds. They are in medical school, nursing school, pharmacy, social work, occupational therapy, physical therapy, and other allied health fields. They will work in teams to complete the course. And as small groups, they will interview caregivers from communities, and the students will learn about their special and unique stories in caregiving. Next, the students, after they learn about that caregiver's unique story, they will reach out to the local Aging and Disability Resource Center, and they will learn about resources that they might be able to suggest for that caregiver and family, and they will provide a unique plan. I think the greatest part about this course is then the students will present that plan back to the caregiver. And many of these caregivers are very savvy. They've done this for a while. They've tried different resources. And this will be the opportunity for those caregivers to actually educate the students about some of the choices that they've made in creating this caregiving plan. Where we are in this project right now is that we are in the process of creating a literature review and the curriculum design. And it is really designed to highlight the fact that there are many different types of cultures that come into caregiving, and that caregiving can be a very private and a family resource that can be unique to each family. And so we are creating a literature review for students to be able to learn about those unique differences. This spring, we will pilot the short course for a small group of students, and the next fall we'll actually launch and go live. So now I'd like to tell you about one more of our projects before Kristen begins. And that's our project with the Department of Public Instruction. This is truly Kristen's brainchild. She's worked on this project for many years, and we're excited to say that this fall we look forward to launch and actually go live on the Department of Public Health and Instruction's website. So we are partnering with the Wisconsin Department of Public Health and Instruction to create and promote a new teaching unit for middle and high school students, and it's called Advocacy for Self and Others, Brain Health. The idea here is that students will learn the skill of advocacy, which is very exciting. I think young people are often passionate about their opinions and certain topics in society. And then they'll go the next step further, and they'll actually learn how to explore credible resources on the internet and from other sources. I think this is really important, especially since we know that there can be a lot of things in the media that are not credible when we're learning about different topics. And next, they will work in small teams and they will explore and learn about brain health topics. So they will go to different stations and they'll learn about the following topics. They'll learn about overall brain health, keeping your brain healthy, aging and the brain, music and our brains, concussion and brain injury awareness. They'll learn about dementia, and finally about reducing stigma and providing care. And I think this last thing is particularly interesting because we know that there are so many middle school and high school students who are actual caregivers, either for a parent or a grandparent or a family member. And perhaps they don't feel particularly comfortable talking to their friends about the fact that they're caregiving, or maybe they don't even understand why their loved one is changing as they advance through the disease of dementia. And so this is a great opportunity for them to be able to start conversations and be able to talk to their peers and look for support. So students will learn about advocacy, and they will work in small groups to create a brain health advocacy campaign. And they will take that campaign to their school, and then they also have the possibility of taking that to their community. So our goal in this project is to raise awareness, lower the stigma, maintain brain health throughout the lifespan, and to also have students where caregivers feel that they are supported and understood. So now I would like to turn this over to my colleague, Kristen Felton, who will talk to us about the resources that we've worked together to create.
Sure, absolutely. I'd like to explain a little bit, though, first about the content of the resources and what it is that you'll be able to share with the people who attend your programs. I'll start off by saying a lot of what we know about lifestyle factors and their impact, their either increase or decrease on the risk of someone developing Alzheimer's disease or another type of dementia, comes from a study mostly that is homegrown right here in Wisconsin. The WRAP study, that stands for the Wisconsin Registry for Alzheimer's Prevention, started at the Wisconsin Alzheimer's Institute by Dr. Mark Sager, 16 years ago now, 99, I think. And what the study does is it focuses specifically on a younger cohort. It's the first study in the world to focus on people pre-symptomatic. So the adult children of people who had a diagnosis of a type of dementia. So the cohort are people who are not showing any symptoms yet, but are at increased risk for developing a type of dementia due to that familiar risk. So there is an increased risk within families for developing Alzheimer's disease. It's not a guarantee, though. Alzheimer's disease and the other diseases that cause the symptoms of dementia have multifactorial pathways. So many different things have to happen in order for a person to move, say, from mild cognitive impairment to Alzheimer's disease, because not everybody does. People within families can have both parents get Alzheimer's disease, but then the children, some may not. So there are lots of sets of risks that need to line up for someone to develop a type of dementia. So there are things that can be done to help reduce that risk. The things that we know are identified from the WRAP study and other studies that are going on now, but looking at a whole host of things about these individuals who, again, join the study pre-symptomatically. They're have a very thorough physical workup. They have many samples taken to see where they're at physiologically, but there are also a lot of questions asked about their lifestyle. You know, what do they do for fun? What are their diet and exercise choices? What are their lifestyle choices? What do they engage in? And now, over time, some of those individuals that started in this study a long time ago have gone on to develop Alzheimer's disease, and others have not. And so this very rich set of data that includes a whole plethora of things that could potentially have an impact on risk has been made available, and researchers around the globe are looking at this data to find these things that we have now come to understand are lifestyle choices that will increase or decrease your risk. So what I'm going to talk about and the things that are on here are the things that research has shown are correlated, are an increase or risk or decrease depending upon what it is. So there are many labs currently in our Wisconsin Alzheimer's Disease Research Center that are looking at these risk factors specifically. So Dr. Barb Bendlin is looking at something around diet. So exercise and diet, as we all know and we all hear over and over again, exercise and diet have such a big impact on our health and on maintaining our health, and that includes our brain health. So having a diet that is high in animal fats, as we all know, are a big risk factor for many things. So Barb is looking specifically, though, at gut health and how the microbiome, which is that mixture of fauna in your gut, how that may interact with your overall health and specifically your brain health. So helping people to maintain a healthy diet, which specifically looking for a brain health diet could be the MIND diet or the DASH diet, the Mediterranean diet, which is basically the DASH diet plus red wine. So people like that one a little better. But basically, they emphasize plant fats because brains use a lot of energy. So you've heard what's good for your heart is good for your brain, and generally that's correct, but no fat diets are not good for your brain. Plant fats are important, and you'll find a lot of plant fats and a lot of good vegetables and fish and other things within these particular diets. Lack of exercise, Dr. Oziomo Okonkwo, as a lab looking specifically at the relationship between physical activity and the risk for developing dementia. Um, there are lots of things that are correlated to exercise and our health, many different conditions, as we know. But he is looking at how much exercise is needed to really have it be enough to reduce your risk. And it's very, very interesting because people don't need necessarily to all exercise at the same level because everyone is different. Some people may want and are able to do more exercise, but some people may get just as much benefit from less exercise. So exercise is important. There's also research that shows that somebody who specifically has dementia related to alcoholism and alcohol abuse is a risk factor for developing dementia. And specifically, it can attack the hippocampus. And individuals who quit drinking and begin to physically exercise again can actually increase their hippocampal volume through that activity, through cardiovascular exercise, through aerobic activity, increasing that blood flow through your brain is very good for your brain, as you might imagine, for many reasons. So exercise is important for brain health as well. Obesity is another risk factor, which is different than lack of exercise. Specifically, waist circumference has been correlated with increased risk for Alzheimer's disease. And again, things that are good for your heart, good for your brain, things that are not good for your heart are not good for your brain, such as a large midsection. Other things that we have just begun to look at as a result of the pandemic is the impact of isolation. We've known that caregivers of people with dementia often become isolated because they become embarrassed or their friends may no longer understand and hang out with them anymore. So people become isolated as caregivers, they become isolated as a person with dementia, and that exacerbates health. We know that isolation and loneliness is as bad for your health as smoking 14 cigarettes a day. So smoking also increases your risk for developing dementia. So alcohol abuse. Also, alcohol is sugar, as we know, and it also kills brain cells. And I'll be talking about the role of diabetes as a risk factor, but sugar is a big risk as far as your diet goes for many things, diabetes included, and diabetes, as I will talk about, is a huge risk factor for Alzheimer's disease. Smoking, which also damages the heart, damages the vessels, and also increases risks for dementia. We heard from a researcher just this past month as part of our research days about just how much that risk is increased by smoking and how much quitting smoking can reduce that risk if someone stays quit over time, no matter what age they are. So if you quit smoking when you're 70 and you're quit for 12 years, you still experience all the reduction of those risks that come with smoking, just as much as someone who's 20. So sleep issues. It's very important to get good sleep for good health. And the sleep disturbance has a correlation with dementia. It's not well understood yet whether people who have sleep disturbance and that's causing the increased risk, or if it's the onset of developing dementia that causes sleep disturbance. So it's something that is important to pay attention to related to your brain health. Getting a good night's sleep is important. Another program that you all work with that's related to dementia is falls and falls risk. We know that people that have dementia are more inclined to fall, but people don't often know that falling can actually be an early sign of progressive supranuclear palsy, which is a type of dementia. My mother-in-law actually developed PSP, and her presenting symptom was falling. So that I found very interesting, and I thought that's something that's important for you all to know as well. So the brain health fact sheet, that's the top link here. I'll show you in a minute, but there's that second sheet here specific to diabetes. Diabetes has a strong relationship with Alzheimer's disease in that diabetes damages blood vessels and blood vessels in the brain, and it affects how brain cells utilize glucose. And as I alluded to before, brains use a lot of energy. Even though your brain is only about 2% of your body mass, it can use up to 25% of available glucose in your body when you're really concentrating and using your brain. So they are energy hogs. They will suck that glucose right up. So when you have diabetes and your brain cells are not able to access that glucose in effective ways, it increases uh, it increases your risk of developing Alzheimer's disease. So it's also interesting. I worked in assisted living for 8 years, and in caring for people with Alzheimer's disease, they will often develop a sweet tooth and love to eat nothing but cookies and candies. And in a sense, that's their brain saying, I need sugar because I'm not getting it because I have a disease. So diabetes and Alzheimer's disease are being looked at as far as the relationship. And there are some researchers that have even gone so far to say that the relationship is so strong that Alzheimer's disease is actually diabetes type 3. So the relationship is important for people who have diabetes to understand. The risk for cardiovascular disease goes up with diabetes, and cardiovascular disease is a risk factor for dementia, especially vascular dementia. Although many people upon autopsy may have pathology showing both Alzheimer's disease processes and vascular dementia. Strokes, little mini strokes, TIAs, all of those things are increased. The risk for those things are increased in someone with diabetes. So as a part of our outreach on brain health, helping people to maintain their brain health, I don't know if you can click on those links to show the sheets. Kathleen?
There we go. Just give me 1 second.
We're just seeing a black screen at this point.
Did it come?
Not yet.
Okay, let me try it again.
You might have to reshare if it took you away from the PDF.
Sorry, just give me 1 more second, please.
No, that sounds good. Does anybody have any questions?
Do you see it now?
Yes, here we go.
Great. And tell me when you want me to scroll down, Kristen, okay?
Sure, go ahead. So this sheet is just the general brain health sheet. As you can see, it talks about getting a good night's sleep, being active, exercise, engaging your brain to help reduce your risk, reducing stress and anxiety to reduce your risk, staying socially active, and eating a healthy diet. So the information that I provided you is supplemental, and you are absolutely able to pass along what I've told to you today. But here is a sheet that you can use that you can hand out in any of your classes. That's just a basic brain health sheet to help individuals who come to your programs to maintain their brain health. And then the next sheet we'll see. Yes, and thank you from Dave Nelson. WIHA will be sending out these sheets and making them available on their website so that you'll be able to hand them out.
Can you see the diabetes sheet now?
Yes.
Great.
And here's one that we've created specifically for the Living Well with Diabetes class. And it talks about how to live well with diabetes, obviously, but also the connection between diabetes and brain health. Yes, it is something that people may have concerns for themselves about for whatever reasons. Maybe it's because they have a parental history and so they're worried, or they've misplaced their car keys and so they're worried, or they actually are experiencing some kind of memory loss or confusion for which there are lots of causes that are not dementia and can be cleared up by talking to your doctor. Things like a vitamin B12 deficiency, you can get a shot and you would be able to have confusion, memory loss clear up. Yes, and most people with diabetes have no idea the really serious connection between their brain health and managing their diabetes. Oh, yes, from Jen Jaco, brain health was the top health need identified in our aging plan for community input. Yes, so there will be resources and information and messaging and activity around promoting brain health and understanding brain health through many channels. That's the point of the BOLD grant. WIHA is just one of our partners and one avenue. And a wonderful partner and a very perfect audience, healthy aging programs to include brain health. It's a wonderful fit. And there's a question, is dementia occurring earlier due to diet, lifestyle, and increasing diabetes, or is it being diagnosed earlier? Well, that's a very good question. We don't have good enough research. I mean, research shows that about half the people who actually have dementia ever get a diagnosis. So whether people are getting them earlier than they were in the past, we don't really know that either. I hope so, with all that said, because that's what we want. We want people to be identified and diagnosed at a time when it's meaningful, that they can meaningfully engage in planning for their future, for what, telling people what they want, for taking that big vacation they've been putting off until retirement, for many, many reasons, for helping families to understand what's coming. So earlier diagnosis is good. I don't think it means that people are getting Alzheimer's any earlier. Although I will say that there are certain populations that are at greater risk and do develop Alzheimer's earlier than others. So Native Americans and Latinos seem to develop Alzheimer's disease at a younger age, up to 10 years younger than white people. And African Americans are also at twice the risk for developing Alzheimer's disease than white people. Reasons for this are not fully understood, but they often are related to access to appropriate health care and prevention and brain health activities, as another little plug. So getting these messages out, and as you heard, we're working with the Department of Public Instruction to start getting these messages out as early as possible throughout the life and through as many channels as we can get our fingers on.
Are there other questions for Kathleen or Kristen? This has been a really, I think, illuminating discussion, conversation around, the impacts of both diabetes on brain health and things that people can do for brain health. I'm going to just really quickly share my screen now so that you can see where these resources are available. The two documents that Kristen just showed you are available on the WIHA website. So if you scroll down on the homepage, you'll see in this green box, Improving Brain Health as We Age, and those two fact sheets are available on the site right now. So we will be sending more information out to you over time, but we encourage you to download and print these off as you, for any of the health promotion workshops that you're doing as a resource for the older adults that are participating in the programs. So, and again, we're so appreciative of the work with DHS on this project, because we think the impact can be enormous, particularly as it spreads throughout our provider network and around the state.
Yes, thank you so much, Chris and Dave and our partners at WIHA for letting us come on your office hours call and share these wonderful resources that you've created.
Thank you, Kathleen and Kristen. This is Dave. I have a quick question as we before we move on, and there may be other questions as well. It seems like one of the lessons that we have learned as we put this information together is that the same habits or practices that you're using to live a healthy life in other ways, exercise, diet, not smoking, are primarily what contributes to health, leading you to a healthier brain when we look at brain health. Is there anything that's outside of, you've kind of talked about this a little bit. So if you look through the whole menu of things that you could do, what you're doing to prevent diabetes, what you're doing to live a healthy life also affects your brain. Would you pull one or two things out that might be more surprising than that general pick, Kristen, that you would say, okay, that's one or two true, but here's one or two more things?
Sure. One of the things we talk about is it's related to resilience, and I'm blanking on the term for it now. It's cognitive reserve. So cognitive reserve means that because what the diseases and conditions that cause dementia are doing is they're killing brain cells. Different diseases start in different places in the brain, so you'd have different symptoms that come first. Alzheimer's disease goes to the hippocampus, which is memory, so that's the first symptom of Alzheimer's. But it's killing brain cells all over. The more connections you have between your brain cells, the more you can afford to lose and still maintain your function. So ways to maintain your brain cells are not doing Sudoku every day, because that doesn't challenge you. It becomes easy. So just like exercise, you want to challenge your brain by doing things that you find hard. Learning a new language, changing careers. Those are really hard things that have been found to really help create resilience. But there are other things too, like level of education is protective, because the more things you learn, the more connections you develop between your brain cells. The size of your social connections, the more people you know, the more protective it is. The size of your geography, so the more places you go. Do you ever leave your neighborhood, city, state, country? That's protective, because again, the more things you know and learn, the more people you meet and learn about, the more places you go and have new experiences with, the more connections you create. So that may be surprising, but.
That's great. Thanks. Any last questions? If not, as you heard in the beginning, we are recording this, so we'll have this recording available so you can come back and take a look at it again. So thank you very much, Kathleen and Kristen.
Yes, thank you.
Thank you so much.
Thank you.
All right. Now I'm going to turn it over to Jill Rankin, who's going to talk a little bit about WIHA program updates. And with that, I will spotlight Jill.
Awesome. You can actually keep Shannon up there right now, because I'm going to have Shannon go first and talk a little bit about stepping on before we get into the other ones.
Sounds great. Thank you, Jill. Yeah, so a lot of great updates for stepping on coming up, as you've probably been hearing for the last couple of years now, and I'm excited to see the light at the end of the tunnel coming a lot brighter and a lot faster now. I actually just had an opportunity to talk with the editor that is working on finalizing the manual last night. And they are very much on track to get the manual all set, the program materials all set by December of this year, so we can work on getting all those packaging materials, those support materials and program materials up to date and ready to go for our 2022 season of workshops. So just a couple of things for that is we will be having program updates, trainings. They will all be done virtually, and those will be done between January and July of 2022. I do want to share that there won't be any exceptions outside of that. Individuals do have to get updated during that time. They will be virtually done, and then they are expected to last about 4 to 5 hours. They are live, so they do have to be engaged through the update training as well. There will be a process to get them registered and so forth. So I'm just asking that you share information with your leaders that or your facilitators for stepping on as to who their registered program provider is. There's a lot of confusion sometimes with facilitators when they are submitting their application. And so I just want to make sure that they understand who that is, because that will delay the process in terms of accepting their application, and we're trying to make sure that they have all the correct information before. And that will be laid out in our announcement email coming out in the middle of November. Also, I see that there was a question already on this, and it's on my update list to share with you too, that there will be a cost associated with it, because you will have, or the facilitators will have to have a new manual. So that does have some fee behind it. Because we don't have the final pages, we don't know how big the manual is, therefore we cannot provide a fee at this time. However, it's not going to be $300, $700, nothing like that. It'll be a much more reasonable amount to plan for. So once that becomes available, we'll also be sharing that. And then let's see here. Actually, that was everything on my list. If there are any other additional questions, please keep in mind that we are working on details and finalizing them through the month of October and the beginning of November. Do write them in the chat, and we'll kind of collect them all at once, and then I can provide answers and send those along with the minutes as we send those out. I know there's a lot of questions coming up, and so I do want to make sure that we address those as they come about, because I want to help you all prepare and help your facilitators get updated in a timely manner as well. Also, we do have a November training coming up that does have a few more spots available. So go to our website. If you do have some facilitators that can get a workshop in by April of next year, we do encourage you to get them trained up. Otherwise, to wait for the new curriculum to come out for that. I see that there was one more pop up here. Oh, yes. So for peer leaders, yes, just like what we did with the recertification trainings, it'll be up to the trained facilitators to update the peer leaders. They will be given an updated outline to do so. And we'll be covering that in the update training as well. Great. All right. Well, thank you. And I'll turn it back over to Jill.
Great. Thank you, Shannon, so much. All right, so we do have quite a bit of things on our agenda to talk with you about today. So I am going to kind of give you a brief overview of some things that we want to discuss with our program provider network. And we'll probably be doing another office hours on these topics, but I wanted to at least throw it out there today. We're noticing, obviously, during this pandemic period, working with several different types of program provider organizations, we're really trying to look at our partners and look at who's been able to continue offering programs, who's needed to stop due to the work and the workload that has happened during this pandemic. So we're trying to look at how best to support our existing program providers, whether it's somebody who can't run the programs right now, or it's somebody who is running the programs, but maybe you're experiencing a little bit less partnership work in your community, things like that. So we're trying to somewhat diagnose where the problem areas are as far as, and then figure out how WIHA can step in and support you and fill those gap areas. So I just want to throw out a few questions, and feel free to type any thoughts in the chat box as I throw out these questions. But like I said, a lot of them might be things that we would like you just to kind of think about. And then when we meet again for our next office hours, or maybe we'll have a special separate webinar to discuss these things, and we would love to hear your feedback on them. So like I said, we've got about 280 program provider organizations in the state of Wisconsin that are working on our programs, that are doing at least one or more of our programs. And at least 150 of them have not been able to continue work since the pandemic started. A lot of times it's because of positions changing, positions leaving, work needing to be done with managing the emergency part of the pandemic, things like that. But what we're hearing from you all, some different things, is that we need to help increase demand that moving these programs to virtual platforms has caused us a challenge in needing to market to a different population maybe, or maybe the typical population that we are marketing our programs to maybe aren't necessarily interested or able to do programs that are virtual. So what we're looking at is if WIHA was to do some sort of direct consumer marketing, would you be able to increase your capacity? So if WIHA if we were able to help you with media outreach and things like that, marketing in your community, we want to make sure that there is then capacity in your area. So we're looking for, we know the problem of increased demand, we need the demand, but we also want to make sure that there are some areas of the state who don't have any capacity to do the programs right now, especially during the pandemic. So that's one question to think about, is if that were assistance to you, would you be able to maybe offer more programs? Do you have enough leaders? Things like that. We want to know and hear from you. The other thing that we're working on to help increase demand is we're working with the Rural Wisconsin Health Co-op, working with community health workers and increasing our work with them. And then also other partners to increase referrals into the programs. So as many of you are aware, the WIHA website has a referral portal on it. So we're working with healthcare providers, especially those who were involved with our programs, but are not able to offer them right now, still be able to refer patients, refer clients and community members into the programs. So we are working on that. But again, if we were going to do that in a concentrated way, we would want to make sure that there's capacity in your area to be able to generate more demand for the program. And then the other question we have is, we are also toying with the idea does WIHA at some point start to provide some statewide virtual workshops sponsored by WIHA? So in areas of the state where there might not be programs available due to pandemic situations and things like that, would that be something where a previous partner or an aging unit or healthcare organization might refer patients into the statewide virtual workshops offered by WIHA? And then maybe would that mean like paying a participant fee or things like that? That's one idea that we're throwing around. And I know I'm just kind of skimming the surface here, but we're having those discussions, and we would really appreciate hearing from you all about those different scenarios, how WIHA may or may not be able to help, if that would be of assistance to you in your area or not. Other questions we have is we're hearing that some people are having success with in-person classes and some people are not. So if anybody has any ideas that you want to type in the chat box for different marketing things that are working, and that the same goes for virtual too. So we're still collecting those virtual marketing tips and then in-person marketing tips, and everything is new now. So kind of like the old standby things that we always talked about, some of them are working and some of them aren't. So if you could, whether you're typing it in the chat box today, or if you want to email me or any of the other WIHA staff to let us know what things are working for you, we're just going to keep collecting those ideas. So we definitely need to hear from you. So whether it's virtual or in person or telephone, we are hearing some people having difficulties with telephone workshops and getting those marketed as well. So if you are successful at those and you know what's working, please let us know. We would love to hear those success stories. So I'm just going to keep talking as people are entering stuff into the chat box. So please feel free to keep reading that as I'm going. One tip that on the topic of marketing and recruitment is, we had heard from, if any of you know Kate Lorig, she is the program author for the self-management program. So Living Well, Healthy Living with Diabetes, Healthy Living with Chronic Pain, Tomondo and Devere, that we do here in Wisconsin. I was able to be on a national work group that Kate was on, specifically on the topic of health living with diabetes. but she was talking about some other tips that she's heard nationally. So I just want to share those today because they're little nuggets that I don't want to just keep as secrets. But what's working nationally is, and I think you've heard me say, email lists and social media is working a lot for these virtual programs. But she also really is pushing and talking about scheduling weekend or evening workshops, which I know isn't always the most popular option for us who are working from 8 to 5. But this is working nationwide when people are doing weekend or evening workshops, and just to see if that's going to be something that would work in your area. The other tip that she gave, which is new, is to schedule work. She said, suggest to schedule workshops so they start on a regular basis. I'm not sure that this is always doable, given depending on how many leaders you have, but i.e. like the first Monday of every month, a workshop series starts, or maybe it's, once a quarter, and have those consistent workshops so that when you're talking to people, you have this regular basis of scheduled workshops. And then also working with healthcare organizations, sometimes that's nice for them to know that there's a consistent program happening that they can refer patients to. So that is a little nugget for the day. And then, like I said, some of the telephone workshops are very successful. Some of them are not. So that's another area that we're looking to figure out. Not only what's working, but also if hopefully I'll get like a flurry of emails in my inbox today. But also if it's not working for you or you're not interested, like what's the barrier? We're trying to figure out what's the barrier to these telephone workshops, because not a lot of people are utilizing them. Is it because it's been really hard to fill them? Or is it because there's another barrier in the way? Is it because the toolkits are a significant cost? Things like that. We would love to hear that so we can figure out what's a best way to remedy that situation, or know whether it's a right fit for our network or not. So that is my flurry of a whole bunch of questions for you. So I'm just going to go ahead and stop and see if anybody has any comments before I give just a couple logistical updates.
So I'm just watching the chat here, and the common theme here is it seems like a lot of providers have lost a lot of program leaders. And so that's going to be something that we all have to work through. So, in some cases, it looks like there's some places where some additional marketing support would help. And you would have the capacity maybe to be able to handle it if we did, get a significant number of people who are interested in a program. That's kind of the concern. Someone said it's a chicken and egg thing, and that's really true, right? We want to increase demand for the programs, but not beyond the capacity that you all can deliver programs in your area. So it's something we're really trying to understand better and wanting to be able to support everybody in doing their programs.
Yeah, for sure. These are all really great. So we're going to keep all these comments. Thank you for entering them into the chat. This is really, really helpful. On the subject of leaders and leader recruitment and losing leaders, we do have a full 2022 leader training schedule that is now posted on our website. So if you haven't been there, please, we encourage you to go check out. I know it does take a while to replenish your leader supply. So reach out to program leads if you want specific resources, specific suggestions on how to recruit leaders for whatever specific program you're working on. So we know it does take work. However, if you are lucky enough to have people to retrain, we do have, like I said, quite the list of trainings that are coming up in 2022. Most of them are going to be virtual because that's what we're hearing from you all, is that that's the easiest and most effective way. And then we also, with the unpredictability of the COVID pandemic, we feel like that's the safest route to go. There are a handful of trainings that will be in person, and you can see that on the website, but most of them will be virtual. So please check out the WIHA website. And we have a tab on the very home page that says Become a Facilitator, and that will take you right to the schedule. And this year, although we have a lot of offerings for 2022, much more than we did in 2021, but we will still be adding ones. And we will still be adding details. We wanted to get you the schedule, and we wanted to do the full year this year, so January through December. But some of those details still need to be worked out. So we will be adding information on there. So if you see something, I think there's like I know we're planning a Revere training in, I think it's March or April, but we don't have exact location yet, things like that. So keep checking back because that document that's attached to the website will be continually updated. And hopefully we can get more leaders. And I know that has to do a lot with partnerships too. So that's something that's definitely reach out to me and the rest of the WIHA staff that we're willing to brainstorm with you and help make those partnerships happen in your communities.
Well, can I just jump in?
Yeah, go ahead, Erin.
Topic of facilitator training. So just a quick announcement with the new program that we're bringing to WIHA, the Stand Up and Move More program, which is a sedentary behavior reduction program. We are extending a special introductory offer. So it will be $100 for the leader training in February and March. And then we'll go up to our regular pricing for the fall trainings. So this is just a limited time offer because we're still in the program evaluation phase. So it might be a great time to get somebody trained in that program at that low rate of $100 for that 2-day leader training. Leader training is done virtually, and that program can be delivered in person, telephonic, or virtually. If you have any questions, you can just reach out to me for that. Thanks, Jill.
Sounds good. Thank you so much. Okay, other quick updates that we wanted to pass on to you along with the leader trainings and the program updates is there will be a Healthy Living with Chronic Pain update curriculum training in 2022. I know we were supposed to get that this fall. However, the Self-Management Resource Center had some issues. They actually had a fire that happened because they're in California that delayed things a little bit. So that will be happening, but it's going to be happening in the first part of 2022. So if anybody has any active Healthy Living with Chronic Pain leaders, information will be coming about that very soon as we get the details. But please plan for that. Again, it'll be very similar to what Shannon was talking about with the Stepping On curriculum updates. It'll be very similar to what we did with the Living Well updates in 2020 and 2019. So stay tuned for that. There'll be a small fee, again, just like Shannon said, for the manuals and the materials that will need to be sent, but that will be virtually, and it will only be a few hours that people they'll have a slot to sign up for. And then the only other quick update I have is Healthy Living with Diabetes. We'll be getting a new manual that's going to be coming in 2022 as well. So it won't be a whole curriculum update, but it will be a new manual. We're working out the details on that as soon as we get that, but there was just some minor changes to the program, not anything significant enough to have an update training, but your leaders will be getting that. So you'll be getting a lot of mail in 2022, I think, with all these curriculum updates, and we'll all be fresh and ready to go with the presentations of the programs. So those are my program updates that I have. Anything that I'm missing? Any other WIHA staff wanted to plug anything else in there?
No, well, great. Thank you, Jill. Thanks everybody for joining us today. We're right at 10 o'clock, so we got everything in and right under the wire. And watch for the WIHA update coming out next week, where you'll be able to get a recording of this session. So if you missed something or you wanted to revisit anything, you'll be able to go back. And as always, feel free to contact any of us here at WIHA. We're happy to get you the right person if we're not. So there's no wrong door.
Great. Thanks, everybody. And thank you for entering all that great information in the chat for us.
Yeah. Thanks so much, everyone. Have a great day.
Bye.